Hey, y'all, welcome back to our first post-Thanksgiving podcast. I finally was able to get off the couch, and I am now joined by Joe Baffone, the co-founder and CEO of Annexus Health. Joe, thanks for joining me today. How you doing?
Good. Thanks for having me, Eddie.
Yeah, thanks for especially after the holidays. Hopefully you guys had a good long holiday. I certainly probably ate too much food, but got up and went for a run this morning, and hopefully we'll start burning some of that off. Excited to jump in and talk to you a little bit about what's happening in the healthcare space, especially in around technology, and talking about the patient access journey today. Would love to just quickly introduce you to the audience so that everybody knows a little bit about you, how you came to be the co-founder and CEO at Annexus Health, and a little bit of what we like to call your origin story around here.
Perfect. Sure. Do you want me to start?
Yeah, go for it.
Yeah. So I am Joe Baffone. I didn't even say my name correctly. Joe Baffone. I am the CEO and co-founder of Annexus Health, and I want to mention my co-founder, Brad Frazier, and I basically, have been working on this thing since way back in 2014. And so my personal story getting to this place is one that started with a patient experience, a personal experience. So my mother, my grandfather, many family and friends that have been through some challenging care journeys, right? Whether it be cancer related or other sophisticated, significant, heavy disease states. So I had a personal history of understanding that it's just not easy, right? It's not easy for patients with significant and substantial diagnoses. And then my personal professional journey was primarily in the life science and pharma world. And I had the opportunity to do a bunch of different things. I won't go through all of those things for you before I became an operator, but two of the most critical experiences I had were managing and leading the teams that were responsible at pharma for the relationship with large healthcare companies and the solutions they provided. And some of the solutions that were provided around access. So access services are things like reimbursement services, copay assistance, travel and lodging, psychosocial services, things of that nature. And that experience, understanding basically what pharma, these healthcare organizations, could buy from other healthcare organizations to service the patient needs and make sure they get the good care they deserve, was really interesting. It was informative for me. I think the most significant thing was the opportunity I had to lead our relationships with advocacy groups and watching people that actually every day were investing in improving the patient care journey, not just one patient, but collectively the patient care journey. And watching that, it actually stirred something in me where I just knew personally I wanted to make a difference. I wanted to do things differently for others because of how things were poorly managed for my family and friends. Yeah. And so I think that stirred me significantly. And I've been in the industry for a long time. So I spent a lot of time doing different things within pharma that I think was informative and foundational. But in 2009, I stepped out to be an operator, and I was part of a company as a principal in this organization that was focused on access services, focused on improving access for patients, but it was more the data side of the world, like looking at data, looking at what's being paid for, not being paid for, and trying to put meaning and action to it to help providers get paid, to make sure life sciences were helping to make sure folks were getting paid so patients could get care, reducing the patient burden. But during that time, I really felt the need to want to do something more significant where I was part of intellectual property that I could manage and really create something that was going to move the space and generationally disrupt. And so I developed a relationship with my co-founder, Brad Frazier, because of a business association we had. We became very deep friends, and we started to just plot out what we wanted to do in the space, whiteboard, discuss over many dinners and cups of coffees and other things. And ultimately, we began working on the technology back in 2014. but launched this thing in earnest commercially in 2018. And this thing, it's Annexus Health. And what we're focused on is creating technology and a services division, so tech-enabled services, to help provider organizations manage everything that's available for patients, like the things I mentioned, right? To access, copay assistance, travel and lodging, psychosocial, other types of things, free drug, to make sure it's managed wholly, completely, and thoroughly, so that ultimately we're reducing the financial toxicities and burdens associated with good quality care, but also removing the administrative toxicities to allow for these things to be instituted, optimized, and fulfilled for patients to get the care they deserve.
I love that. And, I think one of the things that's funny, or maybe not funny, but I think revealing for me, I have, family members who have also been through, significant, I think you used the term like, significant diagnoses, or, like have actual cancer diagnoses, or, Alzheimer's or Parkinson's. And I think one of the things that was surprising to me is that the healthcare system isn't perfect. Like that was kind of like my first revelation. But when you're talking about something that literally on a day-to-day basis deals with life and death and deals with something so important for your loved ones and your family, you really like to think of the institution as a whole as really kind of like, I'm not going to like swear here, but kind of having it all together, right? Like you kind of just expect you're going to walk into a hospital and like, yeah, they know what their processes are, and they know how to handle the patient journey. But just like everything else, there's imperfections in the system, right? And for me, that was kind of like a mind blowing revelation to sit down and be like, oh, these are things that we actually have to like. These are problems that still need to be solved. I just kind of assumed, like doctors, they go to med school, they study for 10 years, and then they just walk into a hospital and they just know how to manage these things. But that is very much not the case. Am I correct?
No, not at all. It's so funny that you say that, because, I'm thinking here, how much do I give in this 30-minute podcast? But ultimately, what you're hitting on is really, truly the essence of our business, right? Yeah. So when you walk into a large institution, a health system, or a community provider, right? And we'll use the cancer diagnoses. These organizations, these provider organizations, they have three main enterprise systems, technologies that they utilize. One is the EHR, the second is the revenue cycle management system, and the third is the pharmacy dispensing software. All three of those enterprise technology platforms serve a purpose. Mm-hmm. They don't serve the purpose of administrative logistics or solving for the administrative logistics necessary to manage the patient's care journey. Right. So the essence of what we do, it's creating that enterprise platform. It's creating the people to use tools and technology to make sure the administrative functions of the patient's care journey are managed. So it just so happens we started with financial assistance and access services, but we are expanding rapidly as we expand the footprint of our technology and the offerings to basically solve for administrative logistics, right? So when a patient comes in and they have rigorous testing and diagnostics and genomic profiling, or the cell and gene space and all of the crazy logistics around that, or the remote nature of patients on oral therapeutics with a sophisticated disease state that's high touch, right? Those things are mind-blowing in terms of the amount that needs to be managed. And if you don't have tools to do that, right, you're using spreadsheets, you're using Post-it notes, you're using nothing. Right. Yeah. So when you walk into, like what you said, these institutions, like, oh, they should have it all together. No, this industry hasn't served. The technology industry hasn't been able to serve the medical industry appropriately because of some of the hurdles that have existed over the years. And we talked a little bit before, some of those hurdles are being broken down by the federal government. Right.
Yeah. And I think a lot of that stuff right now, just like you're talking about, when you go into a hospital, why do they use spreadsheets? Well, because that's what worked. And in order to get any sort of new process in place, it has to be approved. It has to be vetted, normally has to go through the board of directors. There's financial cost. And just like you're talking about right now, we'll dive into, the data piece in a second, but like realistically speaking, I'm getting attacked by a fly over here, but realistically speaking, yeah, dang it. Like it's really hard to get those systems approved because the medical industry is one of the most scrutinized, I think, as far as data privacy is concerned. And in order to get these systems in place in facilities like hospitals, it can easily cost millions, if not tens of millions of dollars to implement, right? And one of the things that you're talking about right now is you got 3 separate systems that were all implemented separately, and how do you get them to talk to each other? And not a single one of them has anything to do with the actual patient journey through the system. It has to do with managing certain aspects, but it's not about the patient themselves. Like, the medication, that's literally about dispensing the medication. It has nothing to do with the person who's actually the center of attention really in the services provided by medical facilities, right? So and I think we blew right past this, but that's the digital connectivity that we're talking about in the subject for today, right? Which is,
for sure,
how do you get all these systems connected, right? So I think we got a lot to unpack in about 19 minutes, so I'm gonna do my best to guide this. But I guess first and foremost, to make a real impact on the patient's access journey, like, what do you think the first thing that you have to do is in order to be successful? And what do you guys focus on in Nexus Health when you're focusing on trying to improve the patient access journey?
Yeah, so I think one of the things that we did very differently in the space is we had a lot of experience in the oncology sector. So we had vast networks of people we could dive in and talk to and really just ask questions of their challenges. And the reason is because I think that the big thing that we're doing differently, and as leaders in this space, we're being very provider centric, right? So when you think about access services in general, they've always historically been very much manufacturer focused, right? Because they're therapeutic focused, because the sponsors, the folks that are paying the bills, the life science, the pharma companies are building out programs to just make sure access to those drugs are created wholly and completely for just the drugs, right? Mm-hmm. Or the entire enterprise of the drugs that are available through the manufacturer of the pharma company. What we've done differently is we went at risk, we bootstrapped this thing, and we created a comprehensive approach for providers to manage all of the content that's available wholly and completely in a workflow that makes sense, to make sure, okay, I find what's available, I manage it all the way through to make sure it's fulfilled and optimized for the patient, for their journey. So I think first and foremost, being provider centric as it relates to these complex disease states, right? These sophisticated disease states is most important to truly be patient focused, as you were describing. Are we thinking about the patient? The only way you're going to be able to think about the patient when it comes to these administrative, financial, logistical challenges and administrative challenges is to make sure that you're comprehensive in your approach. You are very thoughtful of the cycle of the workflow from the provider's perspective to make sure that patient's journey is managed effectively. That's who owns the journey, really. The patient and their caregivers need to own their own healthcare, right? I would advocate for that over and over again. But if they pick the right provider, which should be part of their task, right, then that provider should be able to manage that care journey with them.
Yeah, I got kind of, hopefully not too controversial a question, but I might be poking at something here that I shouldn't. But it's my ignorance. I don't know enough about the space. But wouldn't you assume that? I mean, I know that you guys are working on being provider centric, but it kind of seems to me like that would have been the common sense approach from the beginning. Why were they taking the manufacturer centric approach? I mean, I feel like, I know in a lot of situations that medication and drugs are part of the solution, but that kind of seems like a backwards way to go about it. Almost seems like they're setting it up to make it kind of like a sales funnel into the healthcare system. Like, is there any reason why they set it up that way to begin with?
I think because pharma and the life science organizations were the innovators. Yeah. They were the ones that decided, okay, there are challenges in our healthcare system, right? And some of those challenges are financial. Some of those challenges are making sure that patient's care journey was managed effectively, like offering nurse coordinators to help manage the journey. but they're organizations that are for profit, right? So they
Right.
can't offer a solution that's going to solve everybody's needs. They are going to try to do their best to innovate and solve for the needs associated with their therapeutics. So I think the innovation years and years ago, right, when access services became a thing, is because life science was the innovators and they were the ones writing the checks to offer these services. So I think it just inherently came that way because those were the organizations that were willing to innovate and pay to make sure patients got the care they deserve.
Right, because at the end of the day, it kind of circles back to them. If the process is optimized to get their products into into the facilities, then it would make sense that it's manufacturer centric as opposed to provider centric. And so, by being provider centric, do you guys? I mean, hopefully, do you feel like you still have a good relationship with manufacturers? Are you able to provide that? I would actually assume that what you guys are doing right now is kind of it's more of a neutral stance, focused on the patients. Does that, are you still able to maintain those relationships between facilities and manufacturers, but while improving the patient, the patient's journey?
Yeah, we have to be honest with
Yep.
you. We have a dual business model. So provider organizations pay us either a licensing fee for our technology, or they pay us for the services that we perform, our people perform, that basically utilize our tech and our tooling. So that's one portion of our business. The other portion of our business is the work that we do with life science, that do with pharma. We connect, so it's digital connectivity. We connect with their providers, their vendors, right? That manage their copay, that manage their free drug, that manage their reimbursement services. We create electronic connectivity to make sure the provider can manage all of this comprehensively, but in a more compressed workflow. Push a button. We're connected, right? The other side of digital connectivity is connected to the EHRs, the rev cycles, the pharmacy dispensing software, so that we can pull in the necessary information to pre-populate forms, send it across the wire, pull it back into our system, our comprehensive workflow, and make sure approvals, the amount of the approvals, the work that's being done behind the scene is loaded into the workflow, into the enterprise platform for providers. So great question, Eddie. It seems like you may not know enough about the space, but you understand the space. And our business model doesn't work unless we are not only okay, but super friendly, because that's how we do our automation. That's actually on the life science side where most of our revenue comes from. We're a transaction model.
Cool. Yeah. And I mean, I think, in healthcare, I mean, the manufacturers need to be involved, again, in a lot of these situations, especially with these advanced diseases. The medication is, especially if you're thinking about cancer, for example, like that's almost a requirement to treat it, right? So, but I think that shifting towards, the patient being the center of the model, and it's great that you said you were talking about workflows, because that's kind of the next thing I want to transition to, because it's all of the pieces are required, right? The manufacturers are required, the facilities are required, the people are required. It's how you get it all to work together harmoniously to make the patient journey, improve the patient journey, right? Because these are people that a lot of times are going through probably the scariest time of their life. They have, I remember like even sitting in dentist chairs, which is, not a hospital, but they're talking about like in numbers and like code, and like just sitting there, you're like scared because you don't understand what they're actually talking about. Right. So you're in a vulnerable situation, and, you're trusting all of these people that you are strangers to you to actually, make you better. So kind of a long way of asking, but like, talk to me a little bit about what the ideal workflow is to, to optimize the patient's access journey. And it might be good too to kind of quickly identify what the patient access journey is versus there was another term that you used earlier about the patient treatment journey, I believe it was, like, and why those two are different. But I'm interested to hear what you think about how to optimize the workflow to make it the best that we can for the patient.
Yeah. So when we think about the clinical workflow, the EHR is the tool to manage that. So anyone that's listening that has worked in an EHR or knows what an EHR is, or those that haven't, Basically it's a very sophisticated electronic spreadsheet that has the treatment plan and every detail of that patient's journey clinically, right? What tests, what therapeutics, the schedule, and things of that nature. There's other bells and whistles that are associated with that, but that is the tool to manage the patient's clinical care journey. There, as I mentioned, there isn't an administrative enterprise platform to manage the patient's journey associated with whatever. I mentioned a bunch of different administrative functions, but as I stated, the access journey is those things that are available in the space, mostly provided by manufacturers, pharma, other life science organizations, charitable foundations, to basically eliminate the burdens associated with physician as an intent to treat, right? So really, this is kind of a workflow description too. You get worked up by a physician that you trust. You pick the right caregiver. You're going to trust that caregiver to make the right decisions with you and for you. Once that decision is made, other decisions have to be made, right? Does my payer pay for it, right?
Right.
Are they going to approve it? Are they going to pay for all of it? No, right?
Yeah.
What other assistance is available out there? And then once I find out all of that and what's available, what's my portion of it? And can I handle that, right? And from there, you go to care, right? And things change and you need to continually reassess that. There's continuous opportunities for benefit verifications, prior authorizations, making sure you're seeking assistance funding when it's available or not available. In some situations, like with more sophisticated treatments, you have to be inpatient, so you have to have travel and lodging. Those are the things that are part of the access journey for the patients. There's tons of really cool services out there that are offered by manufacturers and their hub service partners, the charitable foundations. Those are the things that we're talking about. And I listed them earlier, right? It's copay assistance, it's free drug, right, for the right patients. It's reimbursement services to make sure that there's support there so that if the provider is responsible for billing for this stuff to hit the payer, that's all billed and coded correctly. And then ultimately the charitable foundations offer a ream of other services, including some assistance help, financial assistance, significant financial assistance help as well.
Yeah. And so building these workflows out, I have to assume that you have at least a couple of systems talking to each other, which means that there's probably some sort of data transfer going on, right?
Yep.
Yeah. So with that being said, let's talk a little bit about, sharing data and how you can make again, going back to digital, love that buzzword you guys chose, digital connectivity, right? So, because realistically speaking, you have multiple systems that need information about a patient. And, I think one thing that a lot of people are familiar with is, things like HIPAA compliance, but there's a lot of other things out there as well that govern, the sharing of data, between organizations, between systems. It's all around patient protection, but interested to hear a little bit around, how do you guys make that work, and like what's happening in the space right now to get to a place where it's easier to share that information between systems, because I think that's always been like a major blocker in being able to innovate in the space.
Yeah, first and foremost, I would say as a co-founder, the amount of money that we had to invest in security and privacy almost put us out of business a number of times.
Yeah.
Right. So, the one thing I would do differently, I would have raised a lot more money for just that area of our business. Right.
Yeah.
So I think security and privacy is extremely important in the healthcare industry and finance. Right. And so you got to figure that out. You got to figure out the security and privacy approach. And, there's the government, and regulating bodies around like things like SOC 2 and high trust. You just got to do what's necessary to make sure you're meeting the requirements. I think the biggest thing, though, that happened in the space that really significantly impacted our trajectory was the federal government's stance on interoperability. And it started before that, right? It started back in 2011, where that piece of legislation was really meaningful use around electronic health records, right? So
Mm-hmm.
we became better as a healthcare system to use an electronic source to make sure that we are recording the patient information, right? That we're putting it in some place other than a paper chart, right? That we can't find, or we can find sometimes or not find. So that whole process of making sure that we had digital imprints or electronic information data for the patient's journey for their care was really important. And then in 2022, the federal government, the CMS and the OIG had a final ruling on interoperability, and it just said that we're going to create standards around APIs to share data. You're gonna have some carrots and you're gonna have some sticks, but guess what? You all need to comply. And that was a big moment, right? Because there were a lot of healthcare organizations and software companies out there that were putting walls around their data, saying,
Right.
"Oh, no, I want this data because I can make a boatload of money off of it," right? That was broken. So the federal government said, "You're not going to do that anymore. This is the patient's data." Once they said this is the patient's data and you got to find safe, private ways to transfer the data, I believe the space opened up. Now, the federal government, we know, is involved in so many things, they can't get out of their own way to really put a lot. Oh, I hope nobody is going to be pissed off that I said that out loud. But anyway, they did a good job with this, at least getting to this final ruling. And it's got the space in general saying, all right, I can't hold this data, put walls around it. So we're going to share data. So not everybody's ready to share in these API standards as the federal government has described. They want movement, but everybody's working towards that. But because organizations now know they have to share the patient's data so that it improves care and outcomes, and we can measure outcomes, ultimately we're able to digitally connect with the EHR, the rev cycles, and the dispensing pharmacy softwares without as much of a block or a hand-up approach to things. And so I really am really thankful around that piece of legislation and at least some of the steps that we've taken there. So I think that has dramatically impacted the space and the uptake and utilization of technology in healthcare specifically, because now we know as business owners, as tech companies, as data companies, we can't put walls around this patient's data anymore. Eddie's data is Eddie's data, right?
Yeah. It's incredible to me that, like, these are discussions that we've had a lot on this show, especially around, consumer focused products, things like Facebook and Instagram and Twitter, where even Google as well, right? Where, there, because the internet kind of, there was no rules governing it from the beginning. Like the data piece was really kind of the Wild West. And once companies realized that they could use that data, to drive marketing and advertising and, use that for, analysis of personal behavior and all that, that became a cash machine. But it's surprising to me that permeates all the way to the medical field. To me, that would, I guess maybe it shouldn't be surprising. I guess it should probably be more like honestly, Eddie, why didn't you think of that before? Because I guess, it's just yeah, exactly. Right. Like I guess I'm just too naive.
It's the money, Eddie, right? It's the money.
Yeah.
And that's what
I just
people
keep
were doing.
thinking that people are going to be like good, and they're going to be like, well, this is Joe's medical record. Maybe we should leave this private. And, the fact that you should be able to share with another institution within, the medical industry, that to me seems like common sense. But I guess that's probably why I'm not in charge of these multi-billion-dollar companies, right?
Yeah, it's funny, right? I just like to have fun, so I'm being a little bit facetious by this. I'm a capitalist through and through, right? The only reason this business is successful and we're doing what we're doing is because we're making money, right? We have to make money. Our investors require that. My board requires that. But ultimately, we're doing this to generationally disrupt, right? Yeah. We're not doing this to create a stockpile of cash. We're doing this so that we can continue to invest and build this big badass company to change the space. So I think that's different than, maybe some that have that intention, but they say, oh my gosh, the ability for me to build this company is to hoard this data, because the more I hoard this data and demonstrate that nobody else has it or has the volume of this data, then I can sell it for more money. That's a hard balance, right? Right? Or am I managing profits, or am I managing making a difference? It's always good to be able to manage both.
Yeah. And I think that you're, like, honestly, I think you have a really great standpoint on this, right? Like, it's okay to be a capitalist. It's okay to make money, right? But I think that you're doing it trying to solve a problem. You're trying to actually, I like to say, contributing positively to society. Hoarding data isn't really contributing positively to society, right? Like it's he who has the most amount of data wins is not really a great approach to capitalism, right?
No,
So I don't think that being a for-profit company necessarily needs to be exclusive from doing good. You can do both. You're also giving people jobs by being a for-profit company. You're also, to the point we were talking about Backstage, you're creating scale around digital connectivity, right? Because if you guys weren't making any money, you couldn't scale. And if you can't scale, you can't actually get this out and solve, the problem in mass, right? So I don't think they have to be two exclusive ideas. I think they can work together, but I think it's about how you do it, right? It's about having a company that has a little bit of backbone, as opposed to just trying to take the path of least resistance to having the most amount of money in your bank account, right?
for sure. And I think
Yeah.
one thing, and I don't know how close we are to time, but one thing that I would say that I really love about our approach. So Brad Frazier and I are co-founders. We're co-equals, right? So
Yeah.
if a big decision has to be made, it's not like Joe or Brad, it's us together. And we committed early on when we were forming this thing that when we were having challenges making decisions, we will sit in a room and we will stare at each other. And the first question we'll ask is, what's the best thing for the patient? And we have not had a situation where we weren't able to come to a common ground.
That's
And so you
incredible.
just have to ask yourself, what are you focused on? We're focused on changing things for patients.
Yeah, I love that. And yeah, to your point, we are out of time, but I'd like to say thanks for stopping by and having a discussion with me about everything you guys are doing at Annexus. 30 minutes is never enough time, but we do what we can, right?
Yeah.
Yeah, so thanks for stopping by. I appreciate it.
Thanks for having me.
Yeah, Carlos, you got any announcements you want to make before we go?
Yes, Eddie. Tomorrow, right here down below, you can see we're going to be talking to Ben Moadas, the CTO and founder of Stivits. That's right here on Tech Backstage at 12 noon Pacific time. So join us here and be here or be square. Thank you.
All right. Thanks, Carlos. Thanks again, Joe.
Thanks, guys.